Greetings, Local 2627 sisters and brothers. Today is Monday, March 23rd. I hope everybody had a great weekend, and I hope everybody celebrated the St. Patrick's Day holiday. Anyway, to reiterate on what I was talking about in the email that was sent out earlier today, the general membership meeting is a way that we use to contact the members to let members know what's going on, things that they might not have heard of or heard about over the last couple of months, because we have our general membership meetings every other month. It's not something for you to bring up personal issues. Personal issues we talk about on the side unless you know for sure that it's something that will affect everybody there. And we don't go through, we give you the answer, we tell you we're looking into it. We don't want to get into debates. We don't want to get into these debates that take 20 and 25 minutes because you're using up the time. The meeting should take no more than an hour and a half to 2 hours. To start getting into this thing about an issue that you're having and that you're mad about, and a lot of times I'm going to call them gripes. That's not the forum to do it. It's not the forum to do it at all. You can talk to us being DC 37, 2627, anytime you want to, any time of day, actually. So there's no reason to take up everybody else's time with things that don't concern them. So if you have something that is an issue, and the funny thing about it is the people that I've had issues with, they've already talked to me. So coming in, talk to Mike or talk to the reps, coming into the general membership meeting and just carrying on and on and on about it is not going to accomplish anything. These are things that should be done offline. So that being said, next subject. Women are not paid the same salaries as men. We've known this for a long time. On this Wednesday coming up on the 25th of March at 5 o'clock, from 5 to 8 o'clock, there's going to be a discussion. There's going to be a big meeting on celebration of women organizing to promote pay equality. It's going to be attended by Laura Reyes, who's the Secretary Treasurer of ASME, Letitia James, who's the public advocate for the City of New York, and by Mayor de Blasio's wife. And some other dignitaries are going to be there. It might be a good thing because they're going to start seriously getting involved in trying to get women equal pay. We look forward to see as many women as possible to show up on Wednesday. Now, like I'm saying, the mayor's wife, Charlene, is going to be there. So if you want to say something to her, and remember, with Charlene, you may not have known that, some of you, but Charlene was one of our keynote speakers at one of our Black History celebrations about 3 years ago. So she's a friend of 2627. Letitia James is a friend of 2627. We supported her from the beginning for her candidacy to become a public advocate. There's going to be light refreshments sold. I mean, not sold, but given. And ladies and gentlemen are welcome to, but ladies, see if you can come down and spend an hour or two to find out what's going on, because a lot of people have problems. A lot of women have problems with not getting equal pay, the same pay that the men get. And I've heard that, and I keep hearing different numbers, but I hear that women get about 78% of the salary that men get for doing the exact same job. Another thing, health issues. I've had 3 friends or 3 people that I know who passed away from colon cancer. And the people that passed away, the funny thing about them was they had a problem. They felt something in their stomach. They had a problem. They went to the hospital. And all 3 of them were dead within 60 days. They were dead within 60 days. And I'm talking about over the last 10 years, I've known 3 people, and that's the way they went out. If you're over 50, you need to go for colon cancer screening. You have health insurance, so there's no reason. If you find something in your stomach that's causing you pain to go to the hospital, and they tell you that you have colon cancer, you're done. They have to find it before you find it. And let me say that again. You have to find it. They have to find it before you find it. If you find it before they find it, it's a death sentence. So please, and this is for men and women, go and get your colon cancer screening. Go for your colonoscopy. If you're 50, you need to go. You need to be standing in line now to go and get it done. Remember, you have health insurance that covers that. Now, there's also, and let me just say one more thing. If your primary physician recommends you to go to somebody for it and they don't take your insurance, then there is a network of people at DC 37 will give you the network of people who participate where you can go get the the colon cancer screening. This is very, very important. Good and welfare this week. HRA, Kelly Booker, active member, passed away. From HRA also, June Callahan, her mother passed away. And our sympathy goes out to both of these families. Until I speak to you again, this is Robert Ajay in Solidarity. Talk to you soon.